Skin tags are little flaps of tissue that adhere to parts of your neck, underarms, eyelids, groin folds, or under breasts. Although they may look a little strange, they often do not hurt and pose no known medical problem. For these reasons, doctors often recommend not treating them. If, however, you want to remove your skin tags because you view them as unsightly, there are a number of ways to remove them, both at home and by visiting the doctor. Allow the skin tags to go untreated if tags aren't bothersome. Skin tags aren't dangerous, and usually do not cause any pain. Nor do they indicate a medical problem of any kind. For these reasons, it's always a viable option to leave the skin tags alone. Instead of risking potential complications associated with removal. Although various at-home removal options exist, many of them put the patient at risk of scarring, skin discoloration, need for repeat treatment, or even infection. It's probably best not to make skin tags into a problem if they're only a nuisance. Ask your doctor to remove skin tags with a scalpel or scissors, too. Sometimes, doctors will remove skin tags by severing them at the base with a scalpel after numbing the area with local anesthesia. When done properly, this is relatively painless and can be used to treat several tags in one sitting. Ask your doctor to remove skin tags by cauterizing them. Treating skin tags with cauterization, burning, is usually a more sure way of ensuring that tags will not reappear. Cauterization used to be done by heating metal and applying to the area. Today, modern medicine uses electrocautery or chemical cautery. Using these techniques, skilled medical professionals are able to minimize scarring. Meaning that you can use this option in more visible areas, such as the face, neck, and bikini live. Try not to let skin tags get irritated. Skin tags are usually painless and unobtrusive, but, sometimes, they become irritated or begin bleeding when continually rubbed by clothing or jewels. Apply a cream to the skin tag. Certain creams advertise the ability to completely eliminate skin tags. Whether they work or not is up for debate. Although some individuals claim to have had success in using them, there are often no supporting medical studies that corroborate the claim, and they aren't usually recommended by medical professionals. Treat skin tags by tying them off with dental floss, also called ligation. This kills the skin tag by temporarily blocking blood flow to the area. Take a piece of dental floss and tie around skin tag and pull on it, little by little each day. After a day, you should to notice the complexion of your tag starting to change. After several days to several weeks, it should dry up entirely and fall off. Treat skin tags with isopropyl alcohol. This method may sound a little painful, but it's not as bad as it sounds. You should see some clear skin on the top of your skin tag if you look at it in a light. Clip that extra skin off with a nail clipper. There are no nerves in this section, so it shouldn't hurt too much. Your skin tag might bleed, but that's okay. Take some rubbing alcohol and dab it on the tag. Let dry and leave it alone for a day or two. Note that the application may sting and the site become sore. After 2 days, wiggle it, then some more. If you are very sensitive to pain, numb it with ice cubes. Finally pull it out. This won't hurt very much at all. There will be a red spot for the next few days, but just put some aloe vera healing medication on it and the tag scar should go away in about a week or so. Remove skin tags by freezing away. Much like freezing away a wart, skin tags can also be eliminated using liquid nitrogen, OTC store-bought. Removal kits are widespread, offering the patient the option of freezing away his or her tags at home, after application of liquid nitrogen. Skin tags will fall off anywhere from several days to several weeks. Use apple cider vinegar, Rub a little bit of apple cider vinegar onto a cotton ball and soak the cotton ball on the side of the skin tag 3 times a day. Follow this procedure for up to several weeks or until the tag has fallen off. After several days, you should notice the skin tag changing color. It will gradually darken until it eventually falls off. Cover the skin tag with duct tape. Cover the skin tag completely with a small amount of duct tape, keeping it over the skin tag until the tape loosens. When it loosens, check to see whether the skin tag has either loosened or fallen off. If it hasn't, reapply a new piece of duct tape to the skin tag and wait for it to fall off. Use vitamin E and an adhesive bandage. Break open a vitamin E capsule and wipe some of the liquid onto the skin tag. Cover the tag with a Band-Aid. The Band-Aid is supposed to cut off the blood supply to the tag, while the vitamin E helps heal the skin as the tag is sloughed off. Leave the Band-Aid on for several days before checking whether the skin tag has fallen off. If it hasn't, reapply some vitamin E formula and the Band-Aid, waiting for another couple days. Fight the skin tag with tea tree oil. Wash the side of your skin tag with soap and water. Drying thereafter, apply 1-3 drops of tea tree oil to the skin tag, rubbing it into the skin with a Q-tip. Repeat this process 3 times a day until the skin tag darkens and eventually falls off. If the tea tree oil irritates the surrounding skin, dilute it with a little bit of coconut or other oil. You cannot dilute oil with water. 1-to-1 oil to oil is fine. Apply several times a day, as needed. Placing a plaster over the skin tag after treating it with the oil helps the oil work more quickly, and the skin tag could be gone within 2 days.